Okay, so I was assigned this week to talk about epiglottitis in pediatrics. So I made a little PowerPoint for you guys. So what the heck is an epiglottis, you might be wondering? The epiglottis is a flap of cartilage at the base of your tongue in the very back of your throat. That's the thing that's going to stop your food from going into your windpipe when you swallow. What is epiglottitis? As you can see on the right, I included a picture of a child's windpipe. You can see that the inflamed epiglottis has blocked off that airflow. So epiglottitis is when the epiglottis becomes swollen or inflamed and the air actually gets restricted. The 4 Ds of acute epiglottitis, I found this helpful. So it's drooling, dysphagia, dysphonia, and distress. And you can see the little picture of the kid over there. He's drooling. It's just one of the signs. So respiratory distress can happen in the child with epiglottitis. I had a nice picture here. I don't know where it went, but it was just a picture of nasal flaring. So basically, it looks like a pair of nostrils, but wider. But these signs of respiratory distress in the child with epiglottitis will include nasal flaring, sternal intercostal retractions, pale or blue color, tachycardia, and increase in restlessness. And you want to watch for that increase in restlessness, and we'll get to that in 1 second. So we're going to keep in mind that epiglottitis mainly occurs during 2 to 5 years of age. You should never leave the child alone for any reason because they are at risk for aspiration. You should never use a tongue depressor when looking in the child's throat because it can cause an airway spasm. And restlessness, which is one of the main things you need to watch for because it may indicate hypoxia, and that's emergent. How will I know? Well, the child with epiglottitis typically presents in an upright, leaning forward position with his chin thrusted out and his tongue protruding. So I kind of included a little picture of that on the left there, a little cartoon. The child also can present with rapid inflammation around the epiglottis and will complain of a sore throat or have dysphagia. The child can also develop a fever over 102, and that needs to be treated immediately. Epiglottitis is actually an emergency, and the child can die if it's not treated. And finally, I have treatment for epiglottitis, and it typically consists of antipyretics to battle fever, antibiotics for infection, monitoring of respiratory status, obviously because their airway is compromised, humidification if needed, and intubation if needed. And you want to allow the child to sit in the position that they find most comfortable because they're already restless and uncomfortable. So as long as they can breathe, they should be allowed to sit however they're comfortable. And that is the end, and here are some photos, just in case you want to see what it really looks like in there. They're all kind of different stages of epiglottitis, but the middle one, you can see, wow, really, the airway is blocked. And that's it. That's the end. Hope you learned something.